Good evening and welcome to our weekly program, The Week in 30 Minutes. The program that brings to you a number of varied and different reports prepared by our team in the English News Department. This show tries to highlight the main events recently taking place throughout Kuwait. Our active team of reporters are keeping themselves busy around the week to cover and report on many fields in the country, such as education, culture, sports, arts, business, in addition to the events that are currently taking place in Kuwait and may concern you. Like we recently used to do, our episode today is going to be divided into two parts. In the first one, we are going to host and interview Dr. Fizzle Interview, the Director of the Clinical Services at the Dasman Diabetes Institute, to discuss and tackle the services that the Institute offers in addition to the latest in the treating the diabetes here in Kuwait. And in the second part of our episode tonight, we will show our reports as we used to do. Dr. Fizzle, the Director of the Medical Services at the Dasman Diabetes Institute, welcome in the show tonight.
Thank you very much, Hiba. Thank you for having me.
Thank you. It's our pleasure. It's our pleasure. Our viewers, please stay tuned with us, as after this link, we will be back with our guest tonight, Dr. Fizzle Interview. Stay tuned. Dr. Fizzle Interview, the Director of Clinical Services at the Dasman Diabetes Institute. Thank you for joining us tonight in our show, in our new and different episode of our weekly program, The Week in 30 Minutes.
Hiba, thank you so much for having me. It's a pleasure.
Thank you. Our team recently had the opportunity to cover one of the events that are organized by the Dasman Diabetes Institute, which is the World Diabetes Day. I know this occasion is celebrated around the world, but here in Kuwait, the Dasman Diabetes Institute is one of the major entities that can cover and organize such an entity. Can you talk a little bit about this event?
Absolutely, yeah. So we commit every year to celebrating the World Diabetes Day, which is actually on the 14th of November. And the idea of our celebration is to unify all the efforts in the face of diabetes, and particularly on the point of raising awareness about the illness, about its significance, why it exists, how we can prevent it, and methods of management as well. Yeah. So we always have the celebration at Dasman, at the institute itself, and it's a public invitation, so it is open to everyone, and we usually have hundreds of people attending this event at the institute, where we offer free consultations, whether it's screening for diabetes and a blood checkup, or whether it's nutritional advice, medical advice, various consultations. But in addition to that, it's really a family event. Yeah. We focus on having a lot of events for the kids so that we attract them to learn more about diabetes in a fun way. Not in the usual and traditional way. Yes, yeah, thank you. So we try and focus on it being a really family day that is fun to be during that day and at the institute, and to showcase what we're able to do, how we're able to do it, and raise awareness about the illness with everyone.
Yeah, I'm sure that this event is very interesting because it's, as you said a few seconds ago, it's for the family, not only for people that are diagnosed with diabetes.
Absolutely. So that's a very important point, Hiba. So it's not only for people who have diabetes, it's for people who don't have diabetes, families, the general public, just to have more information about diabetes. And we choose a specific day not to signify that diabetes is important only one day in the year. Of course not. But that is the launch of our efforts for the next year, and it's a celebration of these events coming together worldwide. So everyone celebrates World Diabetes Day on that day.
Yeah, of course. I think this takes us to the next question, which is what are the efforts exerted, I mean here in Kuwait significantly, trying to manage this disease?
Yeah, so There are multiple entities and institutions and organizations that tackle the issue of diabetes. Ministry of Health, of course, is one of the big, if not the biggest player that's managing the illness in people who are diabetic and trying to prevent it in those who are not. This is one area. Desman also contributes highly in this area, but also generally organizations that are concerned with health issues. So even businesses and charity organizations and non-profits have turned towards focusing on diabetes, as there is a high prevalence of diabetes within the population, and the numbers signifies to be in the top worldwide, unfortunately, ranking in terms of the spread of diabetes within the population.
Yeah, right. What about the services that the Desman Diabetes Institute itself offers for people?
Yes. So our interest and the premise for establishing Desman is to focus really on the research component. So we try to focus on research that potentially could help in preventing diabetes or in managing the illness better. But of course, in order to reach the levels of research that we'd like to reach, we need patients. And so we offer a multitude of services. We have over 25 specialties at the Institute, offered clinical specialties, medical specialties, for not only diabetes in its different types, so whether it's kids or adolescents or adults, whether it's type 1 or 2, but also any illnesses that are related to diabetes, because as we know, diabetes can cause complications and other illnesses, whether it's heart problems, kidney problems, eye problems, foot problems. So we cover all these specialties within this month. That being said, we also focus on other areas of life where the focus needs to be there, such as nutrition, for example, patient education in a general sense. For example, we do screening in general, so that we try to tackle diabetes before it actually happens. So we try to offer all these services and bundle them under really one roof, and that's one of the important aspects of Desman, where you come to one place to receive a multitude of services.
Thank you for this information. Now we will go to a very quick link and we will be back to our discussion again. Dear viewers, stay tuned with us. Welcome back. Dr. Fizzle Interview, our team had the opportunity to go and cover this event that was organized by the Desman Diabetes Institute. We will have a look right now about it. Desman Diabetes Institute, or DDI, a leading campaigner for diabetes awareness in Kuwait, held an informative event to commemorate the World Diabetes Day. The event allowed visitors to consult with diabetes specialists and dietitians, as well as gather healthy information from booths that explained various facts of diabetes and promoted healthy lifestyle modification. Here is more in this event, in this report by Salim Al-Kandari.
Around 1,000 guests attended Desman Diabetes Institute's World Diabetes Day campaign, underlying the interest in Kuwait to prevent and manage this dangerous lifestyle disease. Many of the booths at the event were about educating visitors on proper dietary habits, knowledgeable physical activities, and oral health. At this event, there were informative booths by the Kuwait Diabetes Society, Kuwait Pharmacists Society, Oral Health Program of the Ministry of Health, and others that provided assistance to people living with diabetes.
We support and we follow the mission of Dasman in taking care of the population in Kuwait to make sure that we try to prevent diabetes from happening. And for people with diabetes, we would like to help them avoid diabetes complications. So as part of prevention, it's extremely important for everybody to exercise on daily basis. Any type of exercise or physical activity that is good for you, anything that can help you raise your heart rate to the point where you're actually working hard and breaking a sweat, that will help you burn the fat, that will help you lose weight and help you protect yourself from the chronic diseases.
What we basically do is we organize events, try to raise awareness and get people involved in this decade's major issues. And in this event right here in Dasman Diabetic Society Institute, we really appreciate their invite. It's been really amazing. You have different booths from different hospitals and different clinics. You have different tests being conducted, and it's been a really amazing experience.
The primary goal of the campaign was to prevent the complications of diabetes in people with diabetes through raising awareness about the complications and empowering those affected by diabetes to proactively take control of their diabetes and improve their quality of life. The main key messages were to take control of blood sugar, watch your cholesterol, keep blood pressure in check, and don't forget your kidneys, and look out for your eyes and examine your feet. From DDI, this is Sam Kendiri reporting for the Week in 30 Minutes.
Dr. Fizzle, welcome again to our tonight's episode of The Week in 30 Minutes.
Thank you.
After viewing this report, this makes me want to ask you something. What about the recent, as you told me before, that one of the major events or services that the Institute offers is the research arena. Yes. So what about the developments, the most recent developments in managing diabetes, I mean internationally?
In a general sense, yes. So at Dasman, we try and actually adopt these new technologies and ways of management as soon as they're actually available and safe to actually use with patients. In addition to actually having others where it's more in the exploration phase. But right now, for type 2 diabetics, we're able to use a once a week injection for some, not all, some, it's quite suitable to use, that replaces the conventional methods of treatment currently. So as you know, a lot of diabetics require insulin or injectable medicines on a daily basis. And so finding something that can be used once a week, and now there's potential for a once every 2 weeks, so twice monthly medicine, are really breakthroughs that we're seeing worldwide and that we're trying to adopt at Dasman as soon as possible. So we're actually in the trial period right now, trying an injection that is once a week, which is something quite interesting.
Of course, of course. I know people that's trying to take an injection like before every meal or at least once daily.
Exactly. So in that sense, some of them, and probably the ones that you're referring to that require more than one injection a day, are usually insulin. They use insulin. So this medicine isn't insulin based, but for those that require insulin, which are mostly type 1 or type 2 when they require the insulin. The latest that is on offer is using an insulin pump instead of the daily injectables. So this pump is basically giving the body insulin regularly throughout the day, and then when you're eating, you actually just program how much extra insulin you need for that meal, but it's an injection that is embedded under the skin and stays there for 3 to 4 days minimum, and then you change it every 4 days instead of pricking yourself on a regular basis. So we've got the biggest group of insulin pump patients in Kuwait and potentially in the Middle East. We have over 350 patients currently on pump being managed at the institute between adults and kids, and we think that this is an excellent replacement of regular injections for those that are able to go through the education process and use the pump appropriately.
That's very interesting. This is really interesting, and I think it's good news for people who are diabetes.
Absolutely.
Yes. Dr. Fizzle Interview, do you want to add anything at the end of our interview tonight to our audience?
Yeah, so we always stress on the importance of screening. And the reason is because recently, actually, the International Diabetes Federation told us that the rates in Kuwait have slightly gone down, which is a very positive thing. So the year before, we were about 23% prevalence in the adult population, which means roughly 1 in 4 people have diabetes. This year, the numbers show that we're down about 3% to 20%, so 1 in 5 are really diabetic in Kuwait, but that figure is quite high. So what we want to stress is the importance of screening. So whether you have diabetes or not, and maybe particularly if you don't have diabetes, we stress on checking yourself once or twice a year just to make sure that you don't have pre-diabetes, what's before diabetes, and that you don't have diabetes and you're not aware of it. Because we know that 50% of people who have diabetes actually don't know. So screening is an important part of prevention.
Very important one, Dr. Fizzle Interview, the Director of the Medical Services at the Dasman Diabetes Institute, thank you so much for being with us here today and giving our audience this valuable information.
Hiba, thank you so much for having me. It's always a pleasure to be here.
Thank you so much.
Thank you.
Dear viewers, stay tuned with us as the second part of our weekly program, The Week in 30 Minutes, is about to start. A recent performance by Russian popular dance group Igor Moiseev Ballet wowed the audience with their artistic integrity. The performance was organized by Kuwait's National Council for Culture, Arts and Letters and the Russian Federation Embassy here in Kuwait. The talented dance group, who performed at the Abdel Hussein Abdul Rida Theatre in Salmiya, received rave reviews from spectators and guests with full house occupancy. Reporter Ghanwa Jabouri brings us the story.
Professional dancing is an intriguing form of art that has the ability to communicate potent messages. Dance can move people, touch people, bring a smile to people, and most of all, dance has the beautiful ability to inspire people. This is exactly what Igor Moiseev Ballet Ensemble succeeded at doing and beyond, transforming the audiences on a magical journey that mesmerized them.
Our company is very famous around the world.